We looked at data from the PURE study, a large international prospective cohort study of 21 countries, 140,000 people on 5 continents. And we identified foods associated with the lowest risk of mortality. And on the basis of these foods, we constructed a diet score, where the more they ate of these foods, the higher their diet score. And then we related the diet score to mortality and major cardiovascular events, and we found that the higher diet score is related to lower risk of mortality and lower risk of major cardiovascular events in PURE. Then we took the same score and we applied it to 3 other separate large international epidemiological studies. The on-target study of 31,000 vascular disease patients, and the inter-heart and inter-stroke study, 2 large international case control studies of MI and stroke. And what we found was that in these studies, there was consistency of the results showing a relationship between higher diet score and lower risk of mortality, major cardiovascular events, MI, and stroke. And so this provides a validation of the score in 3 other large international studies. And so from this, we can better inform dietary recommendations globally to improve diets around the world. So in minimally adjusted models accounting for age and sex, we found a great association with lower risk of mortality, about up to about 40% risk reduction in the highest quintile compared to the lowest. Then, after full multivariable adjustment for all known confounders, we found again a graded association with lower risk of mortality, though the effect estimate is halved with the full multivariable adjustment. And similarly, with major cardiovascular events, we found a graded association with lower risk, though the effect was more modest than with total mortality.
How would you, looking at the quintile that had the best outcomes, that had the highest food scores, how would you relate what that diet was compared to the types of diets that are recommended, say, by the American Heart Association?
Well, the overall nutrient profile of the diet, looking at carbohydrates and total fat, is not that far off from current recommendations. Where there is a little bit of contrast is with the issue of whole fat dairy and with unprocessed red meats. So we find that whole fat dairy up to 3 daily servings is protective, and it's a graded association. We also find that higher intake of unprocessed red meat up to a serving and a half is protective. And this is the part that is contrast. Now remember, the current dietary recommendations are based largely on studies conducted 2 to 3 decades ago and mostly in high-income countries. In these countries, overnutrition is a problem, whereas in many parts of the world, low and middle income countries, there's nutrient inadequacy. And so therefore, if we get globally intake higher of dairy and unprocessed meats and the other foods that I mentioned to the levels that we identified, there would likely be a benefit as far as mortality and major cardiovascular events is concerned.
How practical do you think the food score would be used for the general population? Would people be able to construct a diet for themselves based on knowing what a optimal score was in your study?
Absolutely, because this is a diet that focuses on foods. We don't focus on nutrients. So by looking at foods and the overall dietary pattern, this is much easier for the public to translate into a diet. It's also a very palatable diet. This includes a lot of the foods that people like. So we think that it's widely applicable, palatable, and it would likely improve health. We think that the score should be considered for making broad global dietary recommendations. Now, obviously, the definitive way to come up with the optimal diet would be to do large randomized controlled trials. But of course, the problem with that is it's very difficult to do them. But ideally, that's what would be needed definitively to come up with the best diet. But in the meantime, we rely on the best available observational data, and our findings show that this particular dietary pattern would likely be optimal in the global population.
So you think this is actually ready for real-world use?
We think so, and in large parts of the world, there's nutrient inadequacy. So if we give higher intake of nutrient-dense foods up to the amounts that are in the highest diet quality score, there would likely be beneficial effects globally.